Hello, future nurses. Welcome back to Easy Nurse, where nursing education made easy. So, mainly today we are going to discuss about the community health nursing life. So, in this live, we are mainly covering about the Unit 1 and Unit 2 based on your syllabus. So, which will be helpful for your during exam preparation. So, let's start about the today's live session. So first see about the introduction of the community. So what do you mean by the community? The word actually this community it's originated from the Latin word. Okay. So the Latin word is communes. So from the communes this community is coming. So the WHO or WHO or World Health Organization expert the community on the community health nursing in the year of 1974 by based on the report which is going to agree the following definition. So see the first definition, that is community health. So what do you mean by the community health? It refers to the healthy status of the membrane of the community. Means wherever people will be staying in one particular geographical community area. So in this particular area the health status or health well-being status of each and every people. So that's referred as a community health. To solve the problems which is affecting their health and to the totality of the healthcare which is going to provided by the community healthcare settings. Now come to the next, that is community health, which refers to the health status of the members of that particular community area to the problems which they are going to affecting health as well as the totality of the healthcare provided to the community. So mainly this community health which implies as a broad sense the integrations of the curative, preventive and promotive the health service. So the main focus of community health is nothing but promotion of the health, prevention as well as protection the health from the any disease as well as any kind of the infirmity. Next, community health which refers to the health status of the members of the community, the problems which affecting their health and totality of the healthcare provided by the community. So this definition is given by the Blum. Next, come to the public health nursing. So what do you mean by the public health nursing? It's nothing but this term is mainly used for the community health nursing. So according to the Dr. C.E. Winslow, the public health is nothing but it's a science as well as the art of 3 P's. So what are the 3 P's? First is prevention of the disease. How you are able to how do you able to prevent the disease? If you can able to detect any kind of the disease or infirmity in the early stages of period, so that time only you are the eligible or you will be able to prevent this kind of the diseases, right? Next is the prolonging life. How you are going to prolong the life? By providing the proper healthcare information, proper health education, treatment and managing as well as promoting and preventing the disease or any kind of the infirmity. Next, promotions of the health and efficiency through the organized community effort. So these all are the 3 P's of public health nursing, means these 3 P are the main components. Next, the American Public Health Association or APHA in the year of 1982, they are going to define that public health nursing is nothing but as the one who synthesize the body of the knowledge from the public health science and then professional nursing theories for the purposes of improving the health of the entire community. So it's nothing but it's not only focus on any kind of the particular individually. It's focus each and every community peoples as well as the individual wise in each and every community sector or geographical area. So that is called public health based on the APHA. Okay, and their main focus is nothing but improving the health status and well-being status of the community people. So this community health nursing, it's synthesis of the nursing and public health practice which applied to promotions and preventions of the health of the people. So this definition is given by American Nursing Association or ANA. Next, come to the dimensions. This is the most important topic, that is dimensions of the health. So health has a multi-dimensional practice. So in this the multi-dimensional, what is this? First is the physical dimension, mental dimension, social dimension, spiritual dimension, emotional dimension, vocational dimension and others. So one by one we'll see. Okay. First, come to the physical dimension. What do you mean by the physical dimension? It's nothing but it's mainly implies the nations of the perfect functioning of the body. It's nothing but when each and every part of the body is going to be function perfectly without any kind of the imbalance or without any kind of the lack of the substance or the actions. So that time it's called as a physical dimension. So mainly this health is nothing but it's a biological state in which every cell and every organ is functioning optimum capacity. They're up to their optimum capacity when each and every organ as well as the cell will be functioning. So that is the main concept of the physical dimension. Now come to the mental dimension. So mental health is not more absence of the mental illness. So mainly this good mental health is nothing but it's mainly the ability to respond to the many varied experience of the life, which is ups and down as well as the flexibility and sense of purpose. So when body as well as the mind is going to be considered independent entities, so that time only you can able to lead your life properly. So that is called mental dimension. It's nothing but when it's going to collaborating as a healthy factors. Now come to the social dimension. Social dimension is nothing but it's mainly defined as a quantity as well as the quality of an individual's interpersonal ties and extent of involvement with the community. How much they can able to involve in the community function, in the social practice, as well as the how they can able to cope up their interpersonal ties. So based on that they're functioning. Okay, so that is called social dimension. So mainly the social health which are going to take into account that every individual is a part of the family as well as a wider community, which mainly focus on the social as well as the economic condition. Next come to the spiritual dimension. So spiritual dimension is nothing but it refers the part of the individual which is reaches out and strives for the meaning and purpose in the life. So it's nothing but which is reaches out as well as they're going to striving for meaning and then purposes of the life. As people, some people are having belief in some force that transcend the physiology as well as the psychology of human being, includes the love, charity, purpose, principles, hope in the life, etc. So for that, like some people are preferring meditations, prayer or spiritual gatherings which are organized to maintain the spiritual health. Now come to the emotional dimension. So emotional dimension or emotional health, it mainly refers the feelings of for the others. So it's very much closely related with the mental health and as well as it's considered as an important element of the health. Okay, so emotionally healthy person, when you can consider as the emotionally healthy person, when he or she will be having the positive thinking capacity as well as he or she will be capable for the coping mechanism for every situation as well as the adjusting self and also adapts according to the circumstances. So that is the concept of the emotional dimension. Next come to the vocational dimension. So vocational dimension is nothing but it's a new dimension. It's a very close part of the human existence. Okay, so when your work or whatever you are doing, it's fully adapted to the human goals, capacities as well as the limitation, work often plays a role in promotion of the physical and mental health. So that is called a vocational dimension. So it's nothing but when you already reached your goal and you touched your goals, capacities as well as you are already accept the limitations of your work beyond. Okay, so that is called vocational dimension. So now come to the others. So in the others dimension, like cultural dimension, based on your cultural belief, expectation, etc. Socio-economic dimensions like financial status, social integration, social includement, etc. Next come to the environmental dimension like environmental sanitation, hygiene, etc. Then educational dimension like poverty line, who all are belongs under poverty line, who all are up the poverty line based on the educational purpose. Next is the nutritional dimension like lack of the vitamin or minerals or any other components, whichever is nutrient or whichever is necessary for our proper growth and development of the body. So based on that, as well as curative dimension and preventive dimension. So these all are the others part of the dimension. Now come to the one more important topic, that is health determinants of the health. So mainly determinants is nothing but it's a factors which is influencing the individual's health status, as well as for that they can able to promote and hinder their ability to achieve the optimal health. So that is the main meaning of the health determinants. So these determinants, it can be grouped into the several factors. So first is biological or the genetic factors, next is the behavioral factors, next is the social and environmental factors, healthcare factors, policy factors, as well as the economic factors. So in the biologic and genetic factors, like sometimes due to congenital malformation or sometimes due to the genetic inheritatory disorders, the health or the way of the maintaining the healthy lifestyle, that is also going to be hampered. Now come to the behavioral factors, like which is including in the socio-economic factor as well as the mental health dimension. Next is the social and environmental factor, like environment hygiene as well as a personality and social achievement as well as the social integration. Next is the healthcare cost, mainly who all are people are suffering for chronic disease or communicable and non-communicable disease. So for them to get a proper treatment, they need cost, right? But some people, especially who all are belongs under the poverty line, so for them it's not easy to expend any time somehow cost for the treatment. Okay, so these all are the factors which are coming beyond for as a health determinants. Next is the policy factor, mainly for the poverty people, the government of India, whichever policy they are providing to take a proper treatment with a little bit cost of money, low cost of money, so that is called under policy, as well as the economic factors like financial factor. So these all are about health determinants. So see, first is the biologic and genetic factors, which includes the individual genetic makeup as well as the inherited traits. So mainly the factors as like age, gender as well as the ethnicity, which can impact the healthy outcomes. Now come to the behavioral factors. So in this include like individual lifestyle choice such as the diet, physical activity, what are the food they are going to take, how much physical activity they are doing, how much substance abuse they are already abused or they are not abused, or how many substance they are going to use, as well as the how's their sexual practices life. So these all are the factors which is mainly triggering the emotional balance or emotional factors. So these all are under behavioral factors. Okay, so it's have a very significant impact on the healthy outcomes. Next is the social and then environmental factors. So mainly this includes the factors such as poverty, education level, as well as access to the healthcare, which is mainly helpful for the housing, and environmental conditions such as the pollution, which can influence the individual's health issues as well as the status. Okay, so that is called social and environmental factor. Now come to the healthcare factors. So inside of this healthcare factors is nothing but like preventive care, diagnosis, treatment, screening, analysis, physical examination, as well as the quality of care providing. So these all are the factors are under healthcare factors. Next is the policy factors, like laws and policies which the government of India they are going to implement it for the public health promotion, such as the regulations on smoking or food labeling, as the local policies such as welfare and education program, which are mainly going to impact the healthy outcomes for the public health service. Next come to the economic factor. So it's mainly conditions like employment, income and poverty, which can impact on the individual access to the healthcare professional as well as the other resources which is necessary for the good health. Okay, so now come to the next, that is indicators of the health. So first we have to know what is the meaning of the health. Health is a state of physical, mental and social well-being, as well as not merely the absence of any kind of disease or infirmity. So that is the main definitions of the health which is given by the WHO or World Health Organization. So now come to the indicators. So indicators of the health is nothing but which are mainly helpful to measures used to assess the individual health status as well as the health of populations for of that particular community area. and these indicators may include the various factors such as mortality rates, morbidity rates, life expectancy rates, as well as the prevalence of the diseases rate. So indicators, this sometimes is also known as a vital statistics. Okay, so it's mainly used to monitor the effectiveness of the public health interventions as well as the programs which are mainly helpful to identify health disparities and inform the policy decisions which is related to the healthcare and public health. So these all are the meaning of the indicators of the health. So see the mortality indicators. Mortality indicators, first is the under 5 proportion rate, maternal mortality rate, disease specific death rate, proportional mortality rate, crude death rate, infant mortality rate, as well as the child mortality rate. So these all are the statistical ratio regarding the mortality indicators of the health. Okay, so one by one we'll see the equation. So see first the crude death rate. Crude death rate is nothing but number of the deaths during a year or given year that should be divided by median population of that same year of that same particular area, and that numerical form should be multiplied by the 1000. So that is the meaning of the crude death rate. Suppose 2023 they gave in the census, so based on that number of the deaths which is occur in one particular area in that 2023, that should be divided by the median populations of that same particular area in the year of 2023. Okay, so that multiplication, that numerical form should be multiplied by the 1000. So that ratio is come under crude death rate and it should be considered in a percentage. Now come to the infant mortality rate or IMR. Infant mortality rate is nothing but number of the deaths which occurs under the 1 years of the age in a given year, and that should be divided by total number of the live births in the same year, and that numerical form should be implemented by the 1000. So that is the equations of the infant mortality rate. Now come to the child mortality rate. So it's nothing but number of the deaths which occurs at the age of 1 to 4 years in a given year, and that should be divided by total children of 1 to 4 years which all are present in the midpoint of the same year of that same particular community area, and that numerical form should be multiplied by the 1000. So that is called child mortality rate. Now come to the under proportionate rate. So under proportionate rate is nothing but number of the deaths which occurs in the under 5 years age, and that should be divided by total children under 5 years age of that same particular area, and that numerical form should be implemented by the 1000. So that is called under proportional rate. Now come to the maternal mortality rate or MMR. So maternal mortality rate is nothing but total number of the women which have been dying due to the complications of the pregnancy, childbirth within the 42 weekdays of the delivery in an area which is given in a and within a given year. Okay, so suppose they are collecting based on the 2023. So in the year of 2023, within 42 days of the delivery period, how many women have getting the complications regarding pregnancy, childbirth, etc., and that number should be divided by total number of the live births in that same area in same year, and that should be multiplied by the 1000. So that is called maternal mortality rate. Okay, so these all are the vital statistics or the numerical form of that particular mortality ratio. Now is the disease specific mortality rate or death rate. It's nothing but which is happened number of the death from the typhoid during a calendar year, that should be divided by median population of that same particular area in that same particular year, and that numerical form should be multiplied by the 1000. So now they are giving as an example typhoid. So if they are asking like what is the disease specific death rate regarding HIV infection, so that time you have to know number of the death from the HIV infection during a calendar year, that should be divided by median population of that same particular community area, and that numerical form should be multiplied by the 1000. Now come to the proportional mortality rate. So as example cancer. Okay, so number of the death from the cancer in a year by total deaths from all the causes in that year, and that should be multiplied by the 1000. So proportional mortality rate is nothing but mainly they are searching about the trends of the disease. Okay, suppose some patient they died for the diabetes mellitus. So how you are going to check the proportional mortality rate based on the cancer? So you have to check like number of the deaths from the diabetes mellitus in a year from the cancer in a year, and that should be divided by total deaths from all the all the chronic diseases in the same year in that same particular area, and that numerical form should be multiplied by the 1000. So that is called proportional mortality rate. So now come to the PAC. So what do you mean by the PAC? PAC is nothing but it's a primary health center. So every the rural area, in the village area, PAC is the main healthcare sectors from where the people of that particular community area is getting the primary level of the care. Sometime first aid, sometime medicine, or any other health checkup or anything. Okay. So PAC is the main banyan tree of the rural community area. So PAC was first introduced in the declarations of the Alma Ata in the year of 1978. You just remind Alma Ata declarations, they are going to introduce this PAC in the year of 1978, and then mainly stated that health for all. The main goal of the PAC is health for all, means equally distributions of the treatment given should be done in that each and every PAC area, which should not be based on the any kind of socio-economic factor, any kind of the financial factor, or any kind of the physiological factor. So this health for all could only be achieved through the provision of primary healthcare service. Now come to the Alma Ata declaration, which emphasized the need for a comprehensive approach to the healthcare. Okay, so mainly what they are going to address, they address the social, economic, and then environmental determinants of the health, as well as which is helpful for the empowering individuals and communities to take control over their own health. So these all are about the concept of the PAC. So now come to the PAC service. So what are the service from one PAC you can get as a public health sector? First is the health promotions. How we were going to get this health promotion? By the early detections and screening of any kind of the complications or disease if it is present inside of the body. Okay, so that is called health promotion. Next is the disease prevention, by managing the outbreaks, by providing the emotional as well as the physiological support, and by providing proper components or proper nutrients or proper things whichever is needed to recover from those kind of the health disorders. Okay, so that is called disease prevention. And basic curative as well as a rehabilitative service, under that mainly immunization, not only for children as well as for the mother also, as well as maternal and child health services, family planning, treatment of the common illness, health education, as well as the promotive activities. Treatment of common illness, like suppose one disease condition, it is not that much severe, but you usually get or find it during your home visiting time or the invigilations time. Okay, so that time it is has your right to give some medicines to that particular people. Now come to the next topic, that is PAC is delivered through a network of primary healthcare facility. Okay, so mainly this PAC, which is include the health centers, clinic, dispensaries, as well as the community based program and outreach activities in the particular community area. Okay, so through the PAC you can contact with the health centers, as well as if it is referral is needed, means they will only send you through the from the PAC to the district hospital, as well as if you go for the clinic or dispensary, there also you will get the PAC connections. Okay, so it is often provided by the team of healthcare professionals, including physician, nurses, midwives, community health workers, and then other applied health workers. So these all are the team members are still present inside of the PAC members. So it's provided by the team of healthcare professional. What are this? Doctors, nurses, physicians, midwives, community health workers, other allied health services. So mainly this PAC is an essential component of any healthcare system. Okay, so when the PAC is going to provide the foundations of the delivery and more specialized as well as the advanced healthcare services. It also a key strategy, mainly this PAC is also play a key strategy for improving the healthy outcomes, as well as it's also helpful for reducing the health disparities with the population. How they're going to reduce the health disparities? Like sometimes weekly ones as well as a monthly ones, they are conducting the eye health program, which will be helpful to prevent or to detect the early phases of the eye disorders for the community people. So same as like for other system also, they are collecting sample, they are collecting the data, as well as based on that they are doing their research and they are sending to that report to the higher authority. Next is the in a recent one there has been renewed focus on the importance of the PAC as countries around the world work to achieve the universal health. So nowadays EPAC is coming as a universal. Okay, so if you can get any opportunities for the better job for any other country, so you can also move on. Next is the PAC or primary health center, which is remains as a vital strategy which mainly helpful for improving the health and well-being of the individuals as well as the communities, and it's only ensuring the healthcare services are accessible as well as affordable for each and every community people who all are staying in the community sector. Okay, so now come to the that is Millennium Development Goals. So Millennium Development Goals, it's also known as a MDG. So mainly this MDG is nothing but it's a set of the 8 international development programs or goals which was established by the United Nations in the year of 2000 with a target date of the 2015. So they thought or they targeted the finishing as well as to set the 8 international development goals which will be helpful to set the prior goals of individual as well as to improve their lifestyle to promote the health and prevention of the diseases. So they focused up to the 2015, they will finish all over the India. So mainly these goals were aimed at addressing some of the world's most depressing development challenges including poverty, hunger, disease as well as the gender equality. Mainly as a hilly and then tribal area they have to focus more for the development challenges as including poverty, hunger, disease as well as the gender inequality. So this what are the 8 components of the ADG? That is first is E. Okay, E indicate eradicate extreme poverty as well as the hunger, means which all are the people they are under the poverty line and they don't have enough money to buy food or to cook food for the 2 times at least in a day. Okay, so that is called the hunger. Next is the A. A means achieve the universal primary educations. Then P. P means promote the gender equality and empower the women, means gender equality and empowering women is nothing but like they also have right to do the work in outside as well as they have also right to earn their money by their herself. Next is the reduce the child mortality. Next, improve the maternal health by providing the exclusive breastfeeding, by doing the massaging of the breast after the delivery, by taking care properly by the family, by providing the emotional support to that mother from the husband, etc. Then combat HIV or AIDS, malaria and other diseases. So HIV, AIDS, malaria and other disease, it's mainly coming as a togetherly. Okay, so we have to ensure the environmental sustainability, whether this environment or that particular area where they are living is sustainable or not, whether it's healthy, hygiene, cleaning or not. Okay, next we have to develop a global partnership for the development. So these all are about the 8 MGD steps. Okay, now come to the promotions of the health. So what do you mean by the health promotion or the definitions? Okay, so health promotion is nothing but it's enabling the people which mainly helpful to control the over their health and their determinants as well as the theories of the health which will be helpful to improve their healthy strategies lifestyle. Okay, so that is called health promotion. So health promotion is nothing but like we have to promote the people for controlling their over their health by maintaining the proper healthy hygiene, exercise, healthy lifestyle as well as by maintaining the proper determinants and factors which will be improve their emotional, social as well as the psychological well-being of the health, and that definition is given by the WHO or World Health Organization. Next is the Ottawa Charter for the Health Promotion. So Ottawa is nothing but it's a venue for an international conference on the health promotion in the year of 1987. It was a venue. So this resulting Ottawa chapter proposed addicting to the achieve health for all by the year of 2000. So within the year of the 2000, the Ottawa published is having the some like resulting factors which through this they can able to achieve the health for all for each and every community community sectors in our community area within the year of 2000. So now come to the health maintenance. So what do you mean by the health maintenance? It's a very systematic program as well as a procedure which is mainly helpful for the planning and prevention of the disease, as well as is also helpful to maintain the maximum functions and promote the health by preventing the diseases as well as any kind of the infirmity. So it's a very central to healthcare, especially to the nursing care at all the levels, like primary level of care, secondary level of care, as well as the tertiary level of care. So promotion and then maintenance of the health people of the enables the individual, families and then communities, which mainly helpful to develop their full health potential, which is mainly include the healthy habits as well as the healthy lifestyle. Okay, and health maintenance which is mainly depends on the individual, like behavior, family and then the community as well as the scope of the community. So these all are overview of the health maintenance. So see the factors which is mainly help to promotion and maintenance of the health. First is the socio-economic condition, means social as well as economic factor. After that, immunization. Without immunization, if your immune system will not be boosted, as well as like the circulation system is also not eligible to fight with the antibodies or any other kind of the foreign bodies in the circulatory system, which will be leading cause for the disease and which will be impacting your healthy determinants factor. Next is the prevention of the accidents, mainly for the children as well as for the adults. Then early diagnosis and treatment to prevent the disease. Then healthy exam as well as the screening, health exam and screening. Next is the good habits for the people who all are present in that particular community area, as example environmental sanitation, hygienic cleaning, etc. Then healthy environment as well as the nutrition without any kind of the lack of substance or without a proper amount, sufficient amount of the nutrients should be given, as well as the records whatever you are finding, so you have to record it and then report it. So these all are the factors which is mainly help to promote and maintain the health factors. Now come to the healthy environment. So when you will consider that the environment is healthy, where you are working or where you are living, so that place, if it is hygienic, if it is clean, so that time you can consider it is a healthy. As well as when you are working, so surrounding peoples of that particular sectors or that particular working place, whether is it safe for you, whether they are doing any kind of the social interaction or social misinteraction with you or not. So based on that, it should be considered as a healthy or unhealthy. So there are mainly two ways of the healthy environment. First is maintenance of personal hygiene and second is maintenance of the environmental hygiene. So under this, the personal hygiene like regular bathing, then wearing the clean clothes, regulatory brushing the teeth, as well as we have to take the nutritious food. And disease due to the poor personal hygiene like skin disease, leprosy, as well as the conjunctivitis. Now come to the environmental hygiene. So environmental hygiene in the sense like cleaning we have to do in the surrounding area, as well as the sanitation and water supply also we have to check to get a proper clean water. And disease due to the poor environmental hygiene like airborne disease, tuberculosis, whooping cough, bronchitis, then waterborne disease like typhoid, cholera, diarrhea, as well as the dysentery. So these all are the types or the ways of the unhealthy environment. Now come to the definition of community health nursing. What do you mean by the community health nursing? It is a specialization of our nursing practice which is mainly synthesize the nursing and public health practice in a appliedly to promotion as well as to prevention or to preserving the health of the people. So that definition is given by American Nursing Association or ANA. So according to the Margaret Jacobson, community health which is refers the Italian practice with the ultimate goal of contribution of the individuals and in collaboration with the others to the promotion of patients' optimal functioning through the teaching and delivery care. So that is the definitions of community health nursing. So now come to the philosophy. What do you mean by the philosophy? So mainly this philosophy of community health nursing which is mainly derives from the acceptance as well as a certain concept and changes as well as the facts as the foundations of working with the people. So first is the essential dignity and worth of the individual, the possessions by the individual of potentialities and resources for managing their own lives, the importance importance of the freedom to express the one's individuality, the great capacity for the growth within all the social well-beings, the right of an individual to the basic necessities, the need for the individual to struggle and strive to improve their health and environment mainly as a public health practice, and the right of the individuals to help in times of the needs and then crisis. So these all are the philosophy of the community health nursing. Now come to the aims. What are the aims? First, reduce the morbidity rate and mortality rate by providing and by promotion of the health and preventing of the disease. Next, to promote the health and prevent the occurrence of the disease, like strengthening as well as the self-care activities we have to increase. Then to live a productive life, like maintain the quality of the life. Now come to the goals. What are the goals of the community health nursing? To prevent, promote, maintain and restore the community health, especially the public health, as well as to reduce the morbidity and mortality rate among the community people. So now come to the objectives. What are the objectives? First is provide the antenatal maternity care, postnatal care to the ensure a safe pregnancy and delivery for the mother as well as for the child, and that care should be continued up to the 6 weeks of the postpartum period or as well as the puerperial period. So provide the under 5 clinics for the immunization, developmental assessment, especially for the newborn babies, motor development as well as the gross motor development, advice on the nutrition and child care like exclusive breastfeeding. What are the components of breastfeeding? If the baby is not able to suck properly, then only we have to go for the bottle feeding. Then treatment of the minor elements like papilloma rash as well as any kind of the allergies or any kind of the napkin rash if it is present for the baby, means that we have to take care, and providing the encouragement as well as the support to the mother. Now come to the next topic, that is health education. Also we have to provide the policies for the family planning. What is the family planning? What are the methods of family planning and why it's useful for the society? So that also we have to explain, and we have to teach the people in a correct use of the common medicine as well as the drugs and dangers for the buying medicines at the chemist and market. Okay. So next objective is explain, and we have to promote the use of the local health service in the community area, which will be mainly helpful for advising the people to seek the health care from safe as well as the qualified the health personnel. And we have to assist for the prevention as well as control of the communicable disease. We have to promote the health of the school children through the health service, mainly by conducting the school health services by teaching them hand washing practice, toileting practice as well as the sharing foods and all. Then visit the people in their own house and villages for identifying the health needs and priorities as well as deal with them effectively. So while visiting, we are collecting the data, and based on that we are prioritizing the data, disseminating the data, and we are sending to the higher authority. So based on the applications or approval from the higher authority only we can take the action. Then we have to promote the health of the worker like occupational health. Now come to the principles of the community health nursing. That is also one of the most important topic. So first, community health nursing service should be planned according to the needs of the community, means based on the people number, based on the disease conditions, affection as well as the trends of the disease condition. And community health nurse should be qualified either as a diploma as well as graduate or the postgraduate degree. Okay, and that should be recommended from the INC. Next is the community health nurse should not accept any kind of the gift as well as the bribes from the patient and their relatives. Community health nurse should follow the policy of agency where she is appointed. So community health nurse should not belong to the political group, and there should be the proper facility as well as the job conditions. So community health nurse should focus, function and serve as a important members of the health team, and that community health nurse only maintains a professional relationship with all the leaders of the community. So community health nurse which is mainly follow the ethics while working in the community area. Ethics in the sense like cultural value, cultural belief, their thoughts, their ideas, everything we have to give respect. Community health nurse, they mainly organize the periodic in service education program like school health program, adolescent health program, health campaigns, etc. Next principle, community health nurse could keep the continuous contact with the individual, family and community to take the feedback as well as to provide the proper health education. Then then supervision and guidance also is necessary, which is needed to help the workers to produce the high quality of work as well as provide the high quality of the care, and health service which are available and acceptable to all the people without any discriminations. So community health nurses should create the awareness among the community through educations to promote the community health, and community health nurse they mainly assist the family or community in making the decisions which is related with the health matters of the public health service, and community health nurse should maintain the proper record and report by following that census data while they are going for the invigilations, as well as they have to send that record and report to the higher authority. So these all are the principles of community health nursing. So now come to the definitions of health. As I said, like health is a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. So without presence of any kind of the microorganism or disease or any kind of the infirmity, if the body cells, structure, tissue, muscles, everything or every organ is completely working properly as per their prompt action level, so that time only it should be considered as a healthy. Okay, so that definition is given by the WHO. So there are some factors are there which is mainly causing for the poor health factor. So first is the environmental cause. Under this, lack of the safe drinking water. So if you are drinking the contaminated water, so what will happen? It will affect your gut system, digestive system, and from there you will get the typhoid kind of the disease. Next is the lack of the basic sanitation. If you are not maintaining the proper hygiene level, so what will happen? You will only person will be getting the affected. Pollutions of the water, soil, air and insanitary living conditions. So these all are the environmental causes which is the mainly leading cause for the poor health. Now come to the socio-economic factor, that is illiteracy. If you are illiterate person, so obviously you should not be having that much knowledge about to maintain the socio-economic status which will be helpful for maintaining the proper healthy lifestyle, right? So illiteracy is one of the factor. Tradition, beliefs, cultural patterns. So based on those factors also sometimes the determinants of the health is going to be impacted. Then inadequate nutrition. So for the children, if you are not eligible to give the proper adequate nutrition based on their age wise requirements, so what will happen? Muscle wasting, muscle growth should not be present, as well as brain development should not be happen. So other health determinants factors also coming and impacting. Next is the lack of the personal hygiene. Rapid population growth and poverty is one of the most important socio-economic factor for to conduct a poor health. Now come to the concept of health. So mainly all the communities people are having their concept of health as part of their culture. So but the concept of health is not only perceived by the same way by all the members of the community. So there are so many concepts. First is the biological, biomedical concept, ecological concept, psychosocial as well as the holistic. So see one by one. Biomedical concept is nothing but when health should be viewed as an absence of any kind of microorganism, disease as well as any kind of the infirmity, and if one was free from the disease, so that part time only the person should be considered as a healthy, and this concept is known as a biomedical concept. Now come to the ecological. Ecological is that concept where health is a dynamic equilibrium. Health should be considered as a dynamic equilibrium in between the man and environment, and disease is the maladjustment of the human organism to the environment. As example, water pollution, air pollution. Suppose from the contaminated water, so what will happen? The organism is coming to the gut system and it is creating a disorder like typhoid, right? So that is the so what is happening? This contaminated water or the water pollution is going to be maladjustment of the human as well as the environmental factor. Now come to the psychological or psychosocial factor. So mainly according to this concept, health is not only about the biomedical phenomenon but also it's going to be influenced by the social, psychological, cultural as well as the economic and political factors of the people. So mainly this factor which is taken into the considerations which is mainly defining and measuring the health. So health is both is biological as well as the social phenomenon, and each are going correlated with each other. Next is the holistic concept. So according to the holistic concept, health should be considered as a healthy when it should be act as a sound body with a a sound mind with living in a sound family which is surrounded by the sound environment. Means proper factors should be present. Each and every factor should be present as a promptly and surroundings of the particular healthy people. So that time only that person or that people should be considered as a healthy. And in the ancient times, the sound mind and sound body or sound environment were considered the most important factor for the health based on the holistic concept. So these all are the concept of the health. So now come to the functions and roles of the community health nurse. So first is the collaborator. So as a collaborator, community health nurse, they are mainly solving the problems which can't be solved by a single health workers. Next is the coordinators. So community health nurse, they are also playing a role as a coordinator with the team members like doctor, ANM nurse, laboratory technologist, as well as the health workers or health assistants. Next is the advisor. Community health nurse are also having right to maintain the good IPR or good international relationship with the family and people mainly in the community settings. Next is the counselor. Community health nurse, they are playing as a role as a counselor for providing the proper information and counseling why the factors or determinants are important. As example, family planning, why it's important. So based on that, they have to take the counseling. Next is the advocate. Sometimes they have to play a role as a advocate for promotions of the health. Next is the caregivers. Community health nurse, they are also playing sometimes role as a caregiver at a sudden time when they are mainly going for the visiting. Suppose they are seeing any kind of the disease, and for that time if they can able to provide something also, that is also good for the people, right? So caregiver. Next is the communicator. As a community health nurse, you have to be a good communicator with the people. So you have to be a interaction power inside of you. So what will happen, you can collaborate all the people of the community area and you can able to provide the proper information. Next come to the trainer. Sometimes as a community health nurse, you have to provide the training, basic training about maintenance of the proper health to the community people. So what will happen during the emergency period, at least they can able to manage something. Next is the team leader. You have to lead the other healthcare workers also. Next you have to observe the other people, your planning as well as the intervention, how it's going to impact on the community forum. And next is the health educator. Sometimes you also have to play a role as a health educator by providing the proper health education. Now is community health nursing process. So what is this? Community health nurse, which is mainly meets the goal by identifying the problem in a particular population as well as by supporting the community participations, which is mainly helpful the process of preserving and improving the health of the public sector. Community health nurse mainly follows the systematically, which is mainly series of steps to solve the problem, which is known as a community health nursing process. So community health nursing process is same as like a normal nursing process which is maintained in the hospital setting. So first step is like establish and maintain the IPR with the community people, interpersonal relationship, to build the trust and to build the rapport. Next is the collection of the data. So we have to collect the data like present medical history, past medical history, present surgical history, past surgical history. If it obstetrics history is also there, that also we have to collect, as well as geographical history, environmental history, everything we have to collect. Next is the assess the needs as well as the health problem. So based on the data, we have to analyze and we have to assess the data. What are the disease conditions is under the trends of that particular community area and what are the people are going to be affected. Next is the community diagnosis. Next is the set goals. So based on the diagnosis, we have to prioritize and we have to set our goals, which people we are going to give the care priority. Next is the plan action. Based on the goals, you have to planning for the intervention, then intervention and implementations. After that, we have to evaluate whether this plan, whichever you did for the promotions of the health from that particular disease condition, whether it's affected for the people or whether it's not affected for the people of community. So these all are the community health nursing process. Now come to the importance of the community health nursing process. It mainly helps in the people for maintaining the healthy lifestyle. It's also helpful to protect people from the illness. Identifying the client's health status means early screening and diagnosis, determining the priority rise, which people should be in the priority list as a first. Next, establish the plans for meeting the identified needs. We have to deliver the specific nursing intervention as well as evaluation of the effectiveness of care provided and promote the recovery from the illness. So in this session I discussed unit 1 and unit 2. I hope you all understood my session. Again we will meet in next live session. Till that, keep learning and stay tuned with the easy nurse. Thank you.